Assalamualaikum, everybody. We're just going to wait for a couple of minutes so other participants can also join. Some of them are having connectivity issues. So just give us a couple of minutes and then we'll start, inshallah. Assalamualaikum, Dr. Maida.
Assalamualaikum, Dr. Fahad. कैसे हैं आप?
Good, ठीक-ठाक. I hope you're doing well. Thank you for joining us today. This show would not have been possible.
Thank you so much for this great
Without you.
opportunity. I'm extremely grateful for
Just
this.
thanking you in advance in case I forget later. We're very grateful to you for sparing your time. So we'll just start in 2-3 minutes. I'm still getting some connectivity issue queries. Let me just reply to these people and hopefully then we can start. Let me just share my screen. And, right. All right, just putting a disclaimer out there that I've been told we have a couple of international participants in this meeting here with us as well. So in order that everybody understands the webinar, so me and Dr. Maida will be communicating in English, and I'll request all the participants as well that whatever questions you have, please put them in English so everybody can understand them. I think we have some participants from India, from Hong Kong. So I think it's best that we try to look out for everybody. And I'm sure most of us have taken advantage of such webinars by our international colleagues. So I think it's only fair that we return the favor and show some kindness for them as well. I'll request all participants that please just keep yourselves muted. So that'll be great. And another request is that whatever questions you have, just so that there's no crosstalk and no multiple people asking questions at the same time, I'll request you all to put them up in the chat. And once Dr. Maida is done, specifically, then I'll share your questions from the chat with her, and then she'll be answering them for you, inshallah. So just let me answer this last one text, and then I'll start, inshallah. All right, so this webinar is a two-part webinar. First, I'll be going over some basics of the FFD exam, how to get the eligibility for it, its international acceptance, a little bit about the structure, and then Dr. Maida will be then going into much more detail regarding how to prepare for the exam, the structure of the exam, and everything, which I'm sure is what basically most of you are interested in. So I think we good enough time to start. So Assalamu alaikum, everybody. Hello, good morning, good afternoon, depending on wherever you guys are. So I'm Dr. Fahad Qiyam. I'm currently working as an assistant professor of oral and maxillofacial surgery in Sardar Begum Dental College, Peshawar, Pakistan. And Although I myself have not done or cleared the FFD exam, but I get a lot of queries from juniors and my colleagues regarding this exam. Somehow they think that the exam that I've passed, which is the membership in oral and maxillofacial surgery from the Royal College of Surgeons of Edinburgh, is the FFD exam, which it is not. The both exams are quite different and dissimilar. So I get asked a lot of queries about the exam, and in this regard, whoever comes across to me, I refer them either to most of the candidates I refer to Dr. Maida, and I've always gotten glowing reviews about the help that she gives. So I thought I would spare her the continuous text bombardment and calls that she gets from juniors and colleagues, and I thought just let's make a webinar out of it and put it on YouTube. So everybody who wants to know about the exam can just have all the knowledge and everything that they need in one single place at a time and place of their convenience. So without any further ado, let's get into it, and then let's see how it goes from there. All right, so the contents of today's webinar, specifically my portion, is that I'll be briefly explaining to you what the FFD RCSI exam is and why to give it. We'll also be talking about the eligibility criteria for the exam, the fee that you will have to pay, when and where the exam is held, what exemptions are you able to avail, and what are the number of attempts that you can give for this exam. What is the PMDC equivalence? I know we have some international candidates over here, so probably this heading does not apply for you, but since a lot of our participants are here from Pakistan, so this is very important for them to know what the Pakistan Medical and Dental Council rates this exam as per the locally available qualifications. And lastly, which is also a very hot topic nowadays, especially for us Pakistani candidates, is that if we get this exam, what is the international acceptance and what is the future status of this exam? So what is the FFD RCSI? So exam. So it's a specialist fellowship diploma of the Faculty of Dentistry of the Royal College of Surgeons of Ireland. It's one of the most prestigious professional qualifications awarded to dentists, and it's available in, I think, about 7 or 8 specialties. Oral surgery with oral medicine. I think one is just purely for oral medicine. Then you have it in prosthodontics, endodontics, operative dentistry, orthodontics, pediatric dentistry, periodontology. So available in a lot of specialties. So it's not just limited to us who have trained in maxillofacial surgery or who have trained in oral surgery. So available in quite a lot of specialties. It is awarded by assessment, not by affiliation of other colleges. What this basically means is that this qualification, you will have to sit for it. You have to give an exam, and only then can you be awarded the FFD. The fellowship, the FDS exam, which you might have heard of other colleges, that can be awarded by affiliation of other Royal Colleges. For example, if you have cleared the FFD RCSI exam, then you are eligible to apply as a fellow for other Royal Colleges, like the Royal College of Surgeons of Edinburgh. So a lot of people can get FDS, RCS, let's suppose, of the Edinburgh Royal College, just by being a member or being a fellow of the Royal College of Surgeons of Ireland. So no other way about it. If you want to have this exam, you're going to have to study, give the exam, and then clear it. So why to give it? Now, this is probably a lot of points that I've put in here are probably a lot more applicable to Pakistani candidates, but I think they are somewhat universal. And the first point that I would like to share is, sorry, are you able to see my screen? Not. Just give me a moment. There's some issue with my screen. Yeah, all right. All right, so the first reason for giving the exam is to boost your CV. Obviously, if you have if you've done your local postgraduate training or you've attained your postgraduate qualification from wherever you are working or wherever you trained. So it's never a bad thing to have an additional qualification, especially a prestigious one at that, from an institute like the Royal College of Surgeons. So boosting one's CV, never a bad thing. So that's one reason to give the exam. The most common reason, in my personal opinion, is that people who are stuck in the local postgraduate specialization pathway, they're not able to clear their Master of Dental Surgery exam, or they're not able to clear their fellowship exam of College of Physicians and Surgeons, Pakistan. So one of the major reasons is that. So they want to get a level 3 qualification, and they're stuck in FCPS. They don't know how to clear it, or for whatever reason. So it's a good alternative in that regard. So you get a specialization degree if you are able to clear this qualification. Now, the third reason is that a lot of people, especially in the current economic climate of our country, is that a lot of people, especially a lot of our skilled doctors, are now keen on moving to the Middle East or to the United Kingdom. So that is one reason, because a lot of the Middle Eastern countries, and obviously the United Kingdom as well, would accept or would likes a candidate who maybe has cleared this exam, as opposed to our local FCPS qualification. So one reason can be that. Last reason is maybe a bit controversial, because I myself have given this exam and passed this exam, and that is that the MOMS exam, Membership in Oral and Maxillofacial Surgery of the Royal College of Surgeons of Edinburgh, has rather, I would say, maybe somewhat a controversial status in Pakistan and maybe somewhat abroad as well. Now, the main controversy probably arises from the fact that people who have only done their BDS and trained in maxillofacial surgery in Pakistan, for example, and they are unable to clear the exam, FCPS or MDS exam, and then they choose to go abroad and give the MOMS exam and they clear it. So when you come back, you have to do the equivalence of this degree with the local qualifications. So the problem is that a lot of candidates who haven't cleared their FCPS but give this exam are not given a level 3. They're only given a level 2B. So a lot of work, there's a lot of controversy on this, and I don't want to make this webinar controversial, so I won't get into that. But the status of this exam, since it's a bit, I would say, muddled at the moment, and maybe abroad as well. So maybe that's the reason that a lot of people are thinking about giving the FFD exam instead of MOMS. So anyhow, so these are all the reasons why you might want to think about giving the exam. So let's suppose you are interested for whichever of the reasons that I've already specified. So how to go about giving this exam? What are the eligibility and the fees that you have to think about? So the first thing, obviously, which all of you already would have, is a BDS degree or a Bachelor in Dental Sciences or equivalent basic undergraduate dental degree. Does not matter where you've what the nomenclature is, but as long as it's a basic undergraduate dental degree. So that is the first eligibility criteria in order to give this exam. The second requirement is that you've completed 3 years of your full-time maxillofacial surgery residency program. So it can be a part-time as well. Obviously, part-time is not available in Pakistan, so I'm not going to comment on that if it's a part-time training program. But in whichever country you have a part-time training program which does not exceed 6 years, so that is what they are basically looking for. Now, you may think that the FCPS or the MDS training program in Pakistan is 4 years, so you maybe can give the exam after 3 years, but you have to keep in mind that the 4-year program that we have has about 1 year of rotational trainings. Like you have to spend 2 months in general surgery, in anesthesia, plastic surgery, ENT, neurosurgery, and then there's some optional rotations. Now I think they've introduced general medicine as well. So all these rotations take about a year of your training. So you are basically training only 3 years full time in your parent specialty. So roundabout, I would say the best time to give it would be roundabout the time that you are done with your training. So coming to the fee, it's 1,000 euros for part A and B each. So it's not combined. Now the exam pattern has split, which I'll be talking about briefly, and Dr. Maida will be getting into it a lot more. But you have to pay separately for part A, that's 1,000 euros. And then when you pass part A, then you can sit for part B, and that's again 1,000 euros. So that is the fee. And the after 2019, what they've done is that the Royal College of Surgeons of Ireland have slightly changed the eligibility criteria. Before 2019, if you had passed your parent specialty exam of your own country, then you could have directly come and give the FFD exam. But after 2019, what they've now done is that instead of they've removed the requirement of you passing your FCPS or your MDS. Instead, they want you to complete your training, and you have to now pass the MFD, MFDS, or the MJDF exam of the Royal College of Surgeons of maybe England, Glasgow, Edinburgh, Ireland. That is up to you. Whichever of these you pass, no preference for either of these, but you have to pass one of them. Only then can you sit for the FFD exam. I'm sorry, I've gotten, I think, maybe a query in the chat. Let me just see quickly what it is. If it's relevant, we'll discuss it now. If not, then we'll take it later. Very interesting question, but I think we'll leave this one to the end because I think there's a lot of, it's not a very simple, straightforward answer, Dr. Faisal. So please just, I'll keep this till the end, and hopefully this is the first question that we'll answer once me and Dr. Maida are done with our talks. All right. Okay. I'm sorry, my Zoom is acting really slow today for some reason. So, all right.
Hmm.
I'm very sorry, Zoom crashed. So I've just restarted the meeting. Let me share my screen again, please. Can everybody see and hear me now? All right, fantastic. Sorry about that. I don't know, Zoom was acting very uh, abruptly. Anyhow, all right. So coming to the last point that I was saying that you need to have passed the MFD, MFDS, or the MJDF exam. So is one better than the other? Yes, there actually is. One is better than the other, and for reasons I'll just share with you now. And I think a lot of people don't know this, but if you go through the MFD regulations, which they've recently updated in February of this year, right now, so the other MFDs that you have, MFDS of Royal College of Surgeons of England, MFDS of the Royal College of Surgeons of Edinburgh, MFDS of the Royal College of Surgeons of Glasgow, none of them give you an exemption from MFD Part 1, but the Royal College of Surgeons of Ireland do give you an exemption from MFD Part 1. So what do they give this exemption on the basis of? The exemption is on the basis of candidates who have completed 3 years of specialty training in dentistry will be exempted from MFD Part 1. So um, not only is your eligibility for FFD decided by 3 years of your specialty training, the Royal College of Surgeons of Ireland sort of rewards you for this even one step further by giving you an exemption from MFD Part 1. So this is something which will save you an additional exam that you'll have to give, obviously the fee that you will save, and you can just jump right ahead, give MFD Part 2. And the good thing about MFD Part 2 is that you can give it online from the comfort of your home. So you just need to give the exam fee, and I'll go into the detail little bit after this. But just to show you that the other Royal Colleges do not give you this exemption. Hang on, first let me just tell you how to apply for this exemption, then I'll show you that other Royal Colleges don't give you an exemption from their MFDS or the MJDF Part 1. So how to get this exemption from MFD Part 1? Well, obviously you have to apply for it. So you will have to send an email to this email address, which is available on their website. It's pgexams@rcsi.ie. And you have to specifically ask them for the exemption. They won't give it to you. You have to specifically ask them for exemption, and you have to attach a few documents, which I'm sharing here. You have to send a scanned copy of your BDS degree, your house job certificate, if applicable, your FCPS/MDS training certificate from your own institute or from the postgraduate medical institute, whoever gives you your training certificate. And if you add your PMDC or your local dental council registration certificate, that's a plus point as well. So the more documentation you send, the more your application looks authentic. So these four things is what I recommend everybody to send. So once you send this letter, usually you will get a PDF from them within 2 weeks, and they'll give you an exemption letter from this MFD part 1. And they'll tell you that whenever you are applying for the MFD part 2, you have to upload this letter on their application portal. So where you're supposed to share the result of your MFD part 1, you will instead upload this MFD part 1 exemption letter. So usually you'll get this in about 2 weeks. If they haven't gotten back to you within 2 weeks, you can send them a reminder email. It's not considered a bad thing by any stretch of the imagination. So you can definitely go for that. So once you get your exemption letter, you can go for the online MFD part 2, which is usually held monthly. So it's all you need is basically your own laptop, a good Wi-Fi connection, and you can check the dates on their website. So you can see whichever exam that you're eligible for. You can or you feel comfortable that you'll be ready for that. You can apply for the exam in advance. So sitting for the MFD part 2, although this is not really part of the exam, but a lot of people ask me this anyway, so I thought I'll just put this out there as well, that what do you need to do in order to sit for the MFD part 2? So the MFD part 2, since you have exemption from part 1, you'll have to, there is no exemption from MFD part 2. You have to sit for the exam and give it. So the application fee is 950 euros, all right? And you have 15 OSCE stations in which you'll be examined in 90 minutes. All right. So there are online OSCEs, obviously. If you're going for the face-to-face exam, then there will be physical OSCEs. If not, but mostly since COVID came around, so they wanted to keep on continuing to take their exams. So they converted to this online format. So now you're going to have online OSCEs. So 15 stations you have to do in 90 minutes. All right. In addition to your exemption from MFD Part 1 or a past letter of the MFD or MFDS Part 1, if you have already given the exam, is that you'll have to have a valid BLS certificate, a valid basic life support certificate. So it can be online, it can be face-to-face, but it has to be of the past 2 years and has to be valid at the time that you are giving the MFD Part 2 exam. So you can, there are paid online BLS certificates as well. You can find some free ones as well. And I'll be sharing a group with you where you can find these links to such online and even free BLS courses that they won't charge you and they'll be accepted by the Royal College for the purpose of sitting for the MFD Part 2. Now, question is that can you do it yourself or should you take a course to sit for the MFD part 2? Well, I've had a lot of people who have done it with self-study. I've had some people who've taken courses for this. So you'll have to find what really works for you. But I know a lot more people who have done it by self-study as compared to people who have taken courses. Usually people who take courses for the MFD part 2 or for MFDS are people who are planning on moving to the UK or giving the ORE or LDS exam. So probably those are the people who are taking the courses, but I think a lot of people, in my estimation, have done it just by self-studying. So this is a Facebook group. I myself was contemplating giving this exam during COVID since we were just basically sitting around at home and doing nothing. So this is a very good group in which you can find a lot of resource material to help you prepare for the exam. And you'll find some intention revision course videos here as well. Some WhatsApp groups in case you're interested in doing some combined study for the exam. And a lot of other helpful material here as well. So I would really recommend you join this group. And I've shared the cover photo so you recognize which group it is. Not a lot of course Facebook groups by this name. So I think this is probably the first hit that you're going to find in whenever you search for this group. But it was a very helpful group. Unfortunately or fortunately, hospitals restarted, so I had to abandon my preparation in the middle. and I did not proceed to give the exam. But in case you guys are interested, this is a very helpful platform for you guys to explore. All right, so just showing you and these are screenshots I've taken from the MFD documents, MFDS documents of other Royal College of Surgeons. So this is from the Royal College of Surgeons of England. And as you can see, they don't give you any exemption from Part 1. The only exemption from Part 1 is that you've either cleared the MJDF of the Royal College of Surgeons of Ireland, Part 1, or you've already passed Part 1 of a sister Royal College, like the Royal College of Surgeons of Edinburgh or the Royal College of Physicians and Surgeons of Glasgow, or you've passed MFD Part 1 from the Royal College of Surgeons of Ireland. So England does not give you this exemption based on your 3-year specialty training. In addition to this, the Royal Colleges of Surgeons of Edinburgh and Glasgow also don't give you an exemption. As you can see over here, you either need to have passed Part 1 already of Ireland, or you've already cleared MJDF Part 1, or you've already passed MFDS Part 1 of the Royal College of Surgeons of England. So Ireland, the Royal College of Surgeons of Ireland is sort of facilitating you in this regard, that they are giving you an exemption based on your specialty training. All right. So I briefly talked about this before, that these were not the rules before 2019. However, if there are some amongst you, I would say lazy people like me, who applied for this exemption because I had cleared my fellowship exam in 2016. And then I was contemplating whether to either sit for the MOMS exam or sit for the FFD exam. So at that time, I sent them, this was before 2019, obviously. So I sent them my documents and wanted to get eligibility to sit for the FFD. So the rules before 2019 were that there was no requirement for the MFD, MFDS, or the MJDF. You had to clear your local postgraduate qualification exam. They recognized FCPS at that time. So not every local qualification was recognized by them. They had only recognized some qualifications that they were eligible to sit for this exam. FCPS at that time was one of them. And I think the MDS exam of India was also amongst them at that time. And once the good thing about this is that if you have taken approval prior to 2019, you had the approval, you did not, now you don't need to take approval once again. So all the preparation that I was doing for the MFD, this was actually in vain, because I did not need to now sit for the MFD and then go and take the FFD exam. So this was I'm sharing a copy of the approval letter that I got. As you can see, it's dated in 10th February 2017. So I was given the eligibility to sit for the April 2017 exam. Unfortunately, I did not rate myself highly enough that I would be able to clear the exam at that point in time. So then I switched my attention and focused on the MOMS exam instead. So if you have taken your approvals prior to 2019, you don't need to take them again. This was basically the message that I wanted to convey by including the slide over here. All right. So when and where is the exam held? Well, it's held in predominantly two places. Until now, it was only held in Dublin, so you had to go to Ireland and sit for the exam. But now, from this 2025, they've now also introduced it in Bahrain. So as you guys know, it's quite hard, quite challenging to get a UK visa or an Irish visa. And not to mention the expenses there as well of going there, staying over there. So an alternative option is a little bit closer to home and where you can give the Part B exam, and that is in Bahrain. So since they've changed the pattern now, up until now, Part A and Part B used to be taken simultaneously, and you didn't need to sit for it separately. But from this coming year, they've changed the pattern. So first, you have to sit online for the Part A exam, and once you clear that, then you have to either go to Dublin or Bahrain to sit for the Part B exam. So it's held twice a year. Predominantly, the months are in April and in November. But now the pattern is obviously changing. Once you clear the Part A, whenever it is, then you are eligible to sit for the Part B whenever it is announced. So there is quite a decent gap between the Part A and Part B. So um, a lot of people who used to try and give the FFD exam because it's quite tough, low passing ratio. Dr. Maida will talk more about it. But the Part A was basically about general medicine and general surgery. Now, in other countries, maybe the training is different, but over here, since there wasn't a lot of focus on general medicine and general surgery during our training, so we were quite weak in this regard. So a lot of people, what they used to do was just study for one component, that is maybe just Part A, try to pass this, and then try to pass Part B at a later attempt. But the reason they used to focus more on Part A, which is the general medicine, general surgery component, is that if you had passed this, then you did, and if you failed Part B was oral surgery, oral medicine. So you did not, whenever is the next time that you're going to sit for the exam, so you don't need to sit for Part A again. If you've cleared it once, then you can skip the next, you don't need to sit for Part A again, and you sit directly for Part B. So I think they've probably maybe sensed that this is what the candidates are doing, and maybe they have a lot of candidates to go through. So now they're using Part A as maybe as a screening tool somewhat. So not a lot of candidates now can have to come to Ireland and then give this exam. So because obviously slots will probably be limited. So this is what they've done for the upcoming year. And this is I think they shared this probably maybe about a month ago or something on their website. So you can check this from their website at this address that I've shared over here. So coming now to the structure of the exam. So Dr. Maida will talk a lot more in detail about this. I'm just superficially going through this with you. Part A, as I said, consists of two written papers, but this obviously is now going to be replaced by your online exam. So there are now short answer questions. You have 10 questions and you have to answer them in 90 minutes. And then there will be a structured clinical reasoning question paper. It's again of 90 minutes and it's going to have 14 questions. So this paper A is basically on general principles of medicine and surgery. So now since the component has now changed, now it's online. So now you have 10 multiple short answer questions, which I've already mentioned, and now 10 short critical reasoning assessment. And this is what each paper will be comprised of, and each component will be of 90 minutes. So this is about Part A. Coming to Part B, so Part B is about maxillofacial surgery, oral medicine, and good working knowledge of oral pathology and radiology. So it is possible that general medicine and general surgery might show up in some capacity in this paper as well. So the written paper, you'll have a single 90-minute written paper of 14 short clinical case assessments, and it will explore every breadth of your knowledge from oral surgery, oral medicine, oral pathology, maxillofacial surgery, and radiology. Then you'll have a simulated clinical exam in which you will have two simulated clinical examinations of approximately 30 minutes each. I won't again go into the details. It's Dr. Maida is the expert, so she'll be talking more about this. And then you'll have an oral examination in which you'll have two oral examinations of 30 minutes each. So Dr. Maida will cover these in more detail. So I'll just slowly come towards the end of my talk. All right. So what are the exemptions within this exam? So you do have an exemption, but unfortunately, us Pakistanis cannot avail it because we don't have a medical degree. So you are exempted from sitting for the Part A if you already have an MBBS degree. But since dual qualification is not something that we see happening over here in Pakistan, not now and not maybe in the foreseeable future, so you'll have to sit and study for the Part A exam. There is no exemption, at least for us, in this regard. So we are allowed to have up to 4 attempts at the FFD Part A. This is unlike the FCPS exam, in which you'll have to keep on studying, just keep giving the exam fee, and they'll just let you sit for the exam. But the Royal Colleges, they usually have a cap on the number of attempts that you can give for the exam. So once you are allowed 4 attempts at the FFD Part A, and these attempts must be taken within 4 years of entering for the FFD Part A. It means if you have started, let's suppose you applied once in 2017 for the FFD Part A, so all these 4 attempts, you have to exhaust them within by 2021. So after that, you won't be able to sit for the exam. Now coming to Part B, for Part B, again, you are allowed 4 attempts at clearing the FFD Part B. And once you've cleared Part A, then these 4 attempts you have to exhaust or take up within 3 years of passing your Part A. So there is a time element, time-bound element present if you are seriously contemplating sitting and giving this exam. So one element I would say it's that probably this number of attempts is, I would say it is relevant for us Pakistanis, but the major element here is obviously of cost as well, because you are giving 1,000 euros for giving this exam repeatedly. And especially for Part B, now you have to pay for your tickets, your hotels, your stay and everything. So that is just an added cost, which is probably not in the means of every person who is applying from like a country like ours. So probably for us, maybe an attempt or two is the maximum that a lot of people can do in the current economic climate. All right, so coming to the second last thing that I'll be discussing today, and which is it's a topic that everybody does ask about, is the PMDC equivalence of this exam. So I don't have a letter from PMDC telling you what it is, basically. So I'll be telling you indirect information on what leads me to call this as a level 3 qualification. The problem predominantly is that there are very few candidates who are pure FFDs, meaning that they are not people who have first cleared their fellowships and then they've gone and done their FFD. If you go by that route, you will always get a level 3, even if you have done an MOMS exam, because your major qualification here in this case is your FCPS. So in that regard, in that context, there are very few people in whom we can ask that what equivalency was given to you by the Pakistan Medical and Dental Council. Of the few people that I do know personally, they were given level 3, and they are also currently supervisors within the College of Physicians and Surgeons, Pakistan. We have a professor in Rawalpindi, and we have an associate professor here in Peshawar. So they can only be supervisors if PMDC recognizes their degrees as at least of level 3. So it is by association, by indirect methods, that I'm telling you that FFD is recognized as a level 3 qualification by the Pakistan Medical and Dental Council. So the issue was actually this, that a lot of people are not pure FFDs. They've first done their FCPS, and then they were going for FFD. So that is why there are not a lot of people that we can ask that what actually is the status of FFD by itself. So that was the problem. So anyhow, it does not say the same issues as MOMS, because the predominant issue that I always used to hear about the MOMS exam is that it is a membership exam. It's not a fellowship exam. So I won't get into this debate, and it's not the time or the place for it. But this is one thing that is sort of quoting favor of the FFD exam, that it is a fellowship. So the PMDC won't have a lot of issues in recognizing it as a level 3 qualification as compared to the MOMS exam. Coming to the last slide for today, and then I'll hand over things to Dr. Maida, is about its international acceptance of this exam. So it is recognized in the Middle East as a specialist level qualification. The problem is that a lot of Middle Eastern countries, some Middle Eastern countries, I would say, I can't claim to speak about every Middle Eastern country, but they don't give it consultant status because of a lack of CCST. Now, what is the CCST? CCST is basically proof that the training that you have undergone has been in the United Kingdom. This is given by the General Dental Council. CCST is given by the General Dental Council. So what a lot of people used to be doing was that since they had trained in, let's suppose, India or in Pakistan, and then they were going giving this MOMS exam or FFD exam, and I won't say we were fooling our employers in the Middle East, but we were showing that look, we have a degree from the United Kingdom and you should hire us. So maybe at that time there was maybe not so much of a check and balance that has this person actually trained in the UK, or does he just have a UK based degree? So nowadays, specifically for the UAE, if you want to become a consultant over there, you need to have a CCST. So CCST is Certificate of Completion of Specialty Training. So they ask for this to grade you as a consultant. FCPS, again, FCPS, FFD, MOMS, these are now all considered as specialist level qualifications. Although I still keep on hearing that they do prefer to have people who have UK-based qualifications, but you will just not be recognized as a consultant. You will be recognized as a specialist over there. So that is one drawback that I can tell you about this exam, since this will not enable you to have CCST. So if then that brings me to the fact that what is its status in the United Kingdom and Ireland. So unfortunately, I don't. I tried to find people who might have gone on the basis of FFD to the United Kingdom or to Ireland, and get on their specialist register of their general dental councils. Unfortunately, I couldn't. But what I what I did find was that they do give you an allowance to come and sit on their specialist register, provided you've completed some requirements. So you have to go through this process, which is called as SLAA, Specialty List Assessed Application. So what they basically do is that you have to fill out a form, and you have to show that your knowledge, your skills are comparable to someone who has trained in the UK as a specialist or as a consultant. So in order to apply for this, you'll obviously have to have, first of all, passed the ORE exam of the United Kingdom and of Ireland as well, if you're interested in going to Ireland. And in addition to this, you need to have a degree which is recognized by the countries of these councils as a specialty level degree. So FFD would probably fall into that. Again, I don't know of anybody who has taken this route. What they usually do is that they don't go for the ORE. They just clear the FFD, and they apply there on temporary registration posts, and based on that, they are able to at least work as registrars in the hospitals. Keep in mind, please, that on the basis of FFD, you are not eligible to become a consultant in the UK as a maxillofacial surgeon, because over there, maxillofacial surgery requires a dual qualification. You need to have a dental degree and you need to have a medical degree as well. So, but they also don't need your FFD as well for this matter. I was fortunate enough that one of my juniors from my training days was very helpful in this regard, and she sent me quite detailed voice notes about this. That basically there is an acute shortage of maxillofacial surgery consultants and even trainees in the United Kingdom. So once you apply, once you are over there, you can work there. They can take you from a variety of positions, like a dental core trainee to a senior house officer to even a registrar, depending on what their need is. But you cannot go above a registrar level. And in this regard, the junior that I'm talking about, she has cleared her FCPS and she's also cleared her FFD. But they were not interested in that. They were more interested in what her experience was as a trainee, what sort of procedures she has done as part of her training and her work experience in Pakistan. And then accordingly, she was allowed to do some more trauma and some other procedures as a registrar in the UK. So you don't need this degree. You need basically this experience if you want to shift to the UK and work over there. If you want to register as a specialist, then you can only register as an oral surgery specialist in the UK. But again, we don't know people who have gone through this route and have achieved entry onto the specialist register. What I can give you an example of is I had a senior during my undergraduate years who had cleared the membership in orthodontics exam, the MORTH exam of the Royal College of Surgeons of Edinburgh. And he went to the UK. He went to the UK and he got his general dental license based on the UCLAN pathway, the University of Central Lancashire pathway. And once he cleared that, then he applied to the GDC for this CCST, and he got the equivalence to the CCST. He went on this SLAA pathway, and now he's recognized as a specialist orthodontist in the United Kingdom. So unfortunately, don't know anybody who has gone through the oral surgery pathway, but this is one option that you may want to consider if you want to move abroad. So based on this, I'll come to another very important point, and that is that even if you clear the FFD exam, you are not exempted to the licensing exam. You still have to sit for the licensing exam. If you're going to the UK, you still have to do the ORE, or you have to give the LDS exam, or you have to go through the UCLAN pathway. So licensing, you're not going to get exempted from the licensing exam. So you still have to sit for the licensing exam. And similarly, same goes for the Middle East. You'll have to sit for the license exam of any Middle Eastern country that you're interested in going in. So there is no just any exemption for that. So future directions for this exam, and this is, I think, very important that I share this with you because we recently received this letter, a combined letter from the various royal colleges, the Royal College of Surgeons of England, Glasgow, Edinburgh, Ireland. So what we've taken from this letter is, and again, this is our this is what I'm taking from this exam, from this letter. Does not mean it's going to be completely true, but what we've taken from this is that maybe in autumn 2026 onwards, the FFD exam will be no more. So what they're probably doing is that these four royal colleges are sitting together and they're going to create a new fellowship exam, because the current problem is that Edinburgh has their own exams, Ireland has their own exams, and I think Glasgow has their own exam. So they want to just combine all their exams and have one specific nomenclature. Instead of Edinburgh having just a membership exam, Ireland is having a fellowship exam. Glasgow is again having only a membership exam. So they're probably going to come together and create one single exam, which is probably going to be an FDS RCS. So that is probably what we think this letter means. This letter only came out in September, so we are awaiting further updates from them in this regard. So the good thing about this exam, first of all, will be that then this membership and fellowship debate will hopefully finally come to an end. I won't say a bad thing, but a tougher maybe criterion for passing this exam will probably be set because this exam will be set against the requirement for a CCST. So the exam is going to get a bit tougher than it currently is. I would say specifically for maybe those people who are interested in giving the MOMS exam, MOMS exam, which I gave, probably that's going to get a lot more tougher. So this exam, again, now that all colleges are combining their exam, if you want to sit for this exam, you'll have to give the MFD or the MFDS exam. Currently, people who are interested in giving the MOMS exam or the membership exams of the Royal College of Surgeons of Edinburgh, there is no such requirement to sit for the MFD or MFDS. You just have to send them, apply for the exam and send them your documents, and there is no such requirement. They just need your 3-year specialty training proof, your bachelor's degree, and your PMDC registration. But probably in autumn 2026 onwards, these things will be changing. So you're just going to have to sit and wait to see what further announcements they will do. But this is you can read the full letter if you want. But this is what what we took away from this letter was that now they're going to combine the exams and have just one single FDS exam for all specialties. All right, so that's all for me. Question and answers specifically about the exam will be in the end, but I'm still seeing some things in the chat. So what I'll do is I'll just transfer the host duties to Dr. Maida, and so she can start her portion, share her screen, and I'll see if there are any relevant questions here. I'll just quickly answer them, and then Dr. Maida can just take you guys further. Dr. Maida, you should be able to see that you are the host now, so you can share your screen.
Okay. Can you see my screen now?
Yes, your screen is fine. You just make it full screen, then I think it should be good.
I think it's working now. So thank you so much, Dr. Fahad, for this great opportunity. And Assalamu alaikum, good morning, good afternoon, wherever you all are. I'll be going through basically the exam component of this FFD RCSI exam. So my name is Maida Hanif, and I'm working as Assistant Professor of Oral and Maxillofacial Surgery at Foundation University College of Dentistry in Hospital, Islamabad. So the outline of my presentation includes the components of the exam, which Dr. Fahad have already given you a brief info about, and the materials to cover and books to study, the timeline which is required, and sample paper and passing ratio for this exam. So let's start with the components of the exam. Dr. Fahad has very briefly described that there are two papers, paper A and paper B. So paper A consists of general surgery and general medicine. Paper B is oral surgery and oral medicine. Then there are theory components, which is for both the papers, as well as the OSCE and table viva clinical scenario components for this exam. So the theory paper basically includes the old. There are two ways. There was an old way, which was before I gave this exam. In 2021, when I passed this exam, it was due the COVID time, and fortunately, this exam happened the same way in which they are going to conduct this exam now onwards. I have given my paper A and paper B online, as well as the OSCE online. Therefore, you're also going to have the same pattern. You're going to sit for your paper A exam online. However, you are going to give your paper B face-to-face, either in Ireland or in Bahrain. Just to remind you that the first time Bahrain exam is happening from May 1st to May 3rd. That is going to be probably the paper B, which is the face-to-face component. So paper A is going to happen before that. So the timeline usually starts, in April to November, when you are going to have your face-to-face exam. Before that, you have to pass your paper A. So I'll let you know when you have to apply for that those dates. So previously, they used to give in the old way, you have to sit for paper A and you have to write for 3 long essay type questions, and the time given was 3 hours. However, now you have to just solve 10 short answer questions for paper A, which is going to be online component. Along with that, you have to answer also 14 short critical reasoning assessment. These are short critical cases in which you have to answer very briefly. Both the papers are of 90 minutes. So there is a big time difference between the old way and the new way of giving this exam. Secondly, in the old pattern, you only have to answer 3 questions. Now you have to answer 10 questions in those 90 minutes. So you have to be very careful with the time difference. In the paper B, similarly, there were 3 long type essay questions which were given previously. Now you just have to answer 10 short answer questions, and This paper you have to give face to face. I mean, you have to write this on a paper in either Dublin or in Bahrain. And there are no choices which are usually given for this exam. You just have to answer all the questions. So during the past, the old way of this exam is you have to go to Dublin, and on the first day in the morning they have a paper A, which is from 8 to 11 p.m. It's usually a 3 hours long paper, and in the same on the same day in the afternoon you were given two clinical scenarios from journal surgery and journal medicine. So your day one is just a paper A theory as well as clinical scenario exam. The next day, you have a paper in the morning, which is of oral surgery and oral medicine. It's a theory paper, 3 hours long. And after that paper, you have a OSCE, which where you have to write on a booklet. And then the same day, you have a clinical scenarios from oral surgery and oral medicine. On the third day, you have a table viva. I'm going to give you a brief info about all of these components. Now, this was the old way of the exam. Now, the new way of the exam is you have to give your paper A online. You have to give your paper A short critical assessment reasoning questions online. And then you have to apply for paper B, which is either to be in Dublin or in Bahrain. Um, Once you are accepted and you have passed your paper A, only then you can apply for paper B. And there is a little catch here. When you apply for your paper B, please try to apply for your visa as soon as possible, because um, Irish visa does take a lot of time. I mean, I'll be honest, I just received my passport the day I had a flight in the evening. So you have to be very, very careful when you are applying for your visa, especially to Ireland, because they usually take 1 month's time. And there is a prerequisite which you have to follow. So when you go to Ireland, are going to apply, you're going to sit for your paper B, which is from the oral surgery and oral medicine. It's going to be a 90 minutes long paper. And then you're going to appear in your OSCE paper, which is also going to be a written booklet where you have to answer the questions. I'm going to give you details about all of these in a bit. And then either you'll have your clinical scenarios the same day or on the next day. Probably you can have like 3 days exam, because they have mentioned on their website that from May 1st to May 3rd, they are going to have a face-to-face exam in Bahrain. So probably it will be on the second day. And on the third day, you are going to have your table viva. So let's discuss about paper A, which is the Journal Medicine and Journal Surgery exam. So Dr. Fahad has already shown you the slide. It's available on the website of RCSI, in which you have to apply for this exam online, and you have to give this exam online. The catch here is there is a time difference. Dublin is 5 hours behind us. So when I gave this exam, the exam started around 1 p.m. our time. It was around 8 in Dublin. And you have to be, let me discuss you about the paper types first, and then I'll tell you how to give this exam, because you're giving this exam online. By then you must have given your MFDS exam, and it's kind of same exam. You will have your laptop, and your laptop is going to be locked by the time you log in, because you cannot have anything, you cannot open any other page except the exam paper page. And before you start the exam, the examiner is going to ask you few check questions to make sure that there is no one in the room. You might have to show your room. If you are having any medical condition, if you're expecting or you need any medicine, then you have to tell the RCSI prior, because they have to make sure that you're comfortable, but same as you don't do anything which may cancel your paper. So you have to give them all this information before you sit for this exam. The exam, you might have to log on from your mobile as well, or from your laptop, and you have to show them the room, probably the washroom as well. And there should be no books, nothing around you. You have to lock the room when you are giving this exam. And you will be monitored on two screens in Ireland. So make sure you don't do anything because you will be blacklisted for this exam for the rest of your life if you do anything wrong. You cannot cheat during this exam because your screen is going to be locked during the whole time. You can only either go forward. I think you can go back. What I remember, I can go to the question number 1 because the time is very short. So I would always suggest that try to be very fast. You should have a very good writing speed on computer and try to be as accurate and as simple as you can. So the paper A theory component mostly includes the journal surgery, journal medicine topics. There is a component of journal surgery, but most of the exam questions were from journal medicine. I will give you a detail of all the topics, most important topics either, because they try to cover almost all the aspects of journal medicine and journal surgery during these 90 minutes. So I would suggest if you are working, because when I gave this exam in 2019, I just passed my FCPS exam, and I don't have to study for oral medicine, surgery component a bit in detail because I was already studying for my FCPS exam. But if you haven't studied for your FCPS exam yet, I would suggest you to study. To start this exam preparation almost 3 to 4 months in prior, because after all, it's quite a serious exam and the passing ratio is very less. So just for paper A, you need to have at least 1 to 2 months of study time. You need to revise all the topics a few times because it's been a while we have studied journal medicine and journal surgery. So there are good chances you're going to forget everything. I would always suggest that you have to start from topic wise, like in a systematic way. You should start from CNS and cover most of the topics. We can provide you with the list of the topics which are very, very important, but try to cover all the systems. Do cover the oral aspects when you are covering the journal aspects, because this might help you in the clinical scenarios. They ask a lot of questions from the oral aspects. Then in journal surgery, you have to cover certain topics quite in detail, like thyroid, vascular anomalies, nutrition, post-op care. There are many more, but these are something which I have encountered. They have asked me in clinical scenarios a lot. So a little info about how to write for your paper. You have to write in pointers. You can only write 150 words for your one question. So you can only answer you can only answer one question in 150 words. The questions I'm going to give you a sample question. It's quite long, so you just be very, very specific. You don't have to write everything, just write what they're asking you for. Be very, very specific. And you should not try to have any spelling mistakes or anything which is going to make the sentence very long. Your sentences should be small, and they are readable and they are accurate, because the paper is in English. So try to comprehend your sentences in a very good way. For every question, you just get like 7 to 8 minutes, so that you can, at times there is a network connection or something like that. So just be very fast while attempting this paper. When I attempted this paper in 2019, the theory exam was almost a month before the face-to-face exam, but the result was announced after part B. In your case, you will get your result after part A. Once you pass paper A, only then you are allowed to sit for paper B. However, in my case, I have to give paper A as well as paper B, and then overall result was announced. So this is a new component which has been added, which is the 14 short clinical reasoning assessment. In my exam, or at my time, we were given 2 clinical scenarios from journal surgery and journal medicine. However, now I think they want to assess that component by giving 14 clinical short reasoning assessment. So I have attached a screenshot here. You can see that there's a picture and there's a question. You just have to answer this. It's going to be very simple, but the questions might have like one question might have different short questions attached to it, so you have to be quite fast. It's just a one-liner or a one-sentence answer, so just make sure that you're accurate, because if you are not going to answer the proper thing they're asking you, then you will not be. This question will get you a 0 marks, and you won't be able to pass this exam. The passing ratio for paper A is 60% marks in either component. That is the theory component and the short critical reasoning assessment component. So candidates who have training or who have a component where they are trained in general surgery and general medicine during the residency, unlike 2 months of rotation in our case, you have to be properly trained. Like in UK, they are exempted to sit for paper A. I have friends who have given FFD and they are not from Pakistan, they are from UK. And they were exempted for paper A. So if you have a training in which you have done the surgical and medical component, then you are exempted to appear for paper A, and you can directly sit for paper B. So the books that I have studied is Bailey and Love for Journal Surgery. We can provide you a list later on those who are willing to sit for this exam. But make sure that you study those topics in detail. I'm not very sure about everything because I've given this exam few years back. The pattern is going to be changed now. So make sure you do cover most of the topics from journal medicine. So Kumar and Clark, I can show you the book. I've studied the bigger book, but I've also used this baby book. Please try to buy this book if you are planning to sit for this exam and study this book as much as you can. Whenever you have time, study all the systems, and this is a very good book, and I think this book has helped me a lot. Then there is a book which is Washington Manual of Surgery. I've covered few topics from this book as well, especially of the journal surgery. Then Scully's Medical Problem in Dentistry is something which we all should study, being OMFS, but this book is mandatory for applying for this exam, because if you want to pass your oral surgery, oral medicine component, or either journal surgery, journal medicine component, this book is like a holy grail. You have to study this book and try to cram most of the things which are there, especially the oral components, like the oral aspects. Then I've also studied a lot of things from Google, ATLS manual, NICE guidelines. They are quite mandatory to sit for this exam. The examiner asks you about NICE guidelines for so many things. And I'm also grateful Dr. Fahad was huge help. I asked him for so many articles when I was applying for this exam, and he was generous and grateful enough to, find those articles for me and always send me. So you have to study those articles there. I mean, it's up to you, because the examiner is going to ask you in your viva, especially the latest modalities and the new inventions in that particular aspect. So try to read as much as you can. We have so many groups of OMFS, and there are so many cases, so try to focus on those cases. So timeline to study is 2 to 3 hours. I have studied almost 2 hours every single day. It's very hard to study when you are working as well. So try to, try to balance your time. But you do need to have like 1.5 to 2 months to study for this exam for sure, especially for this paper. And try to revise as much as you can, because we tend to forget a lot of things, and it's great if you have a study partner. Passing paper A is mandatory to sit for paper B, so make sure you pass this paper, you are well prepared, and try not to forget this component, because you're going to be asked about this in your paper B as well. So these are the two papers. One is my own paper, and the other one is a paper of, I don't know, 2017, 2018. I was lucky enough that two of my seniors or mentors who have given this exam, Dr. Adnan Islam and Dr. Uzair, they've given this, like, I don't know, maybe 10 years back. But they were gracious enough that they have given me few past papers, and this was one of the past papers. You can ask me, I can send you those past papers, but you see in the old pattern, you have like 3 hours and you have to attempt these 3 questions. You were given a booklet where you have to answer each question in quite some detail, like one For one question, you get 1 hour. However, in my paper, which was exactly like how you're going to have your exam about, it's like 10 questions, 90 minutes, and you have to answer all the questions. I have just written the main statements, but usually the questions were scenarios, and you have to read the scenario and then you have to answer accordingly. So there were trauma assessment questions, then there was from cancer, there were from hyponatremia, pulmonary embolism, airway trismus patient, consent, types of shock, anemia. Medical ethics is something which is asked a lot in Ireland. So it's not something which we are quite familiar with, especially in Pakistan. So try to go through these aspects as well, especially the medical ethics and the patient management, patient safety. This is something they have asked a lot there. So try to cover these things as well. Then the paper B, which is of oral surgery and oral medicine. So your paper A is going to be entirely online. It's just a 1 day exam in which you have 180 minutes straight, 90 minutes for one component and 90 minutes for the other. For first 90 minutes, you're just going to answer 10 questions, no choice, and it's going to be from the general surgery, general medicine, mostly from the general medicine. And in the second component, there are short critical reasoning where you have to answer 14 questions in 90 minutes and you have to be fast and you have to be accurate. It's like a short critical reasoning sort of a question where they are going to give you a scenario and then ask you multiple questions related to that scenario. So you have to, it's just a word or just a one sentence answer. So you have to be very fast, but you have to be accurate to pass this exam. Once you have passed paper A, they will send you an online confirmation that you have passed your paper A. Then you have to apply for paper B. This paper is going to be in Dublin or in Bahrain. So for this, you have to go to Ireland or Bahrain. So for paper B, Dr. Fahad has already shown you this slide. So during the first day in the morning, you're going to have 10 questions of 90 minutes and you have to write down the answers on a sheet. So this you have to write it down. The other one you have to type. So here there are going to be examiners. You can see all people who have passed paper A there with you. And you have to be very fast to answer this. I'll be very honest. I've given this part as online, but you're lucky enough, you're going to go there and answer these there. And then after this, I'll tell you what they're going to ask you. So they are going to ask from everything. Those who have done FCPS, because I've done FCPS, so I know the preparation is exactly like what we study in FCPS. You're going to cover all those topics, and apart from certain other things, because there are certain things which are very important, especially like autoimmune conditions, which are there in Europe, and then HIV, AIDS, all transmissible diseases. You have to cover the journal aspects as well as the dental aspects of everything as far as the oral medicine is concerned. So the time duration, since I gave this exam and I was preparing for my FCPS, so I don't have to study a lot. But if you are preparing as somebody who has not been appeared in FCPS or MDS exam before, then you need to give at least 2.5 months for this exam, for especially this component, because there are a lot to cover here as well. So you have to study oral medicine, oral pathology, oral surgery, radiology, everything. So again, you have to give your answer in a very straightforward manner. Whatever they're asking you, just write that, because obviously the time is less, again, very less for this paper. You just get like 7-8 minutes to write one answer. So be very, very fast. Try to highlight things which are important. You can make flow charts, whatever you like. In your online exam, you cannot make any flowchart. You just have to type your answer, or you can highlight few things. But you have to have a very good writing speed, as well as very nice writing skills, because it should be readable to the examiner. Then paper of oral surgery and oral medicine is from everything. What we cover in our residency of oral surgery here in Pakistan. And don't write anything which is irrelevant, or they are not they've not asked and you're still trying to write it down. Don't do this there, because in that way you won't be able to complete your whole paper. There is no choice. You have to answer all the questions. Now, passing paper B is mandatory in order to pass the whole exam. Paper B is something which is not being exempted for anyone. Everyone has to be there to sit for paper B, whether they are exempted for paper A, but they have to sit for paper B. So the books which I've read for paper B are like everything, you name it, and I've studied it, because I was already preparing for my FCPS exam. I've passed my theory exam, so I know I have to study all of these books. So you can do Peterson, Wadbooth, Fonseca, Scully, Medical Problems in Dentistry. I've already mentioned this book before as well. Then I did Soames for Oral Pathology, Cowson, Fundamentals of Orthognathic Surgery from Malcolm Harris, because they do ask a lot of questions in your table viva from orthognathic surgery. Dental implantology is a very basic component, and you might get asked a lot about implants. Then again, nice guidelines and Google. And I would always say study as much as you can, because you never know what they're going to ask you. There might be something you have not seen in your viva, but you might recall from your previous knowledge of from these books. So time to study timeline is it depends on you. The more the merrier, because I don't know, we might need a lot of time. I mean, 4 years is less to pass FCPS exam, and still, I mean, I would say 4 months is less to appear for oral surgery and oral medicine component. I've seen people passing paper A and couldn't make it to paper B, though we are trained in oral surgery and oral medicine component more than our paper A component, but still this is something we think it's quite easy, but this is quite hard. So this is not something you can get away very easily, especially for this exam. You have to study in order to make your paper be a success. So topics which I've covered is orthognathic surgery, oral oncology, and reconstruction. I was asked about reconstruction there, so you must know a little bit about reconstructions. Not as we were being asked in FCPS. They don't ask flaps in detail there. Then trauma is something they ask a lot, and the plating system and everything. So you have to be very careful on your trauma component. Then cyst, cleft lip, and palate surgery. I'll tell you, because they asked me to mark the cleft lip repair points on, he was showing me a patient on during my table viva, and he asked me to put the marks. So I'll discuss that in the table viva component. So please try to understand what you are studying so that you can reproduce that later on. Then BLS, ATLS, you might get asked in trauma how you're going to manage this patient. So you always have to start from BLS or ATLS protocols. So you should be knowing all of this. And the latest advances in OMFS, because in table viva, I do remember they asked me about the latest advances in oral and maxillofacial surgery, new approaches, new therapies being introduced recently. You might get asked. So try to be well aware of all these things. So this is a sample of paper B. These were past papers where paper B was also of 3 hours and you were asked 3 questions. But just to let you guys know, this is how they ask questions. So in one of the paper, they asked you write an account of etiology, clinical presentation, and surgical management of bilateral fractured mandibular condyle. So you get 1 hour to write for this one question. However, now you just get 90 minutes and you have to answer 10 questions. So this might be a STEM, and then you might have 1 or 2 questions related to this. So just to let you know, you have to be very, very specific when you are answering for your paper B. So one was my paper, the paper B of 2021. This was the paper I was given, and I have to write it online. However, you're going to write it on a piece of paper. They're in Ireland. So it was on the developmental and anatomy, etiology, incidence of unilateral cleft lip and palate. The other question was also from cleft lip and palate. The third one was also from cleft lip and palate. Then there was a bilateral condylar fracture question. The other one also from the bilateral condylar fracture. Then Horner syndrome, lichen planus, Sjogren's, complications of management of condylar fracture treatment, and chronic orointral fistula was being asked. The other paper was one of my friend who was gracious enough to send me his exam paper, and these were the questions. He had to write it down. Now, this is the second component of paper B, where you were being given a booklet, and it's an OSCE exam. There are no stations like in our FCPS exam. During OSCE, we were given stations. However, in this exam, there were no stations. There is no examination component. You just have to write it down in this component, and you will be provided a booklet in which there are going to be 15 questions, as you can see here, and you will be given 90 minutes. So each question, like 15 question means 15 bigger stems, and there are going to be subsequent questions after every stem. So let's discuss my paper. So paper B from November 2021, there was a bigger stamp about lichen planus. It could be a picture, it could be anything. And then there could be questions like, give us DD, how will you diagnose this condition? How will you, there could be an X-ray, or there could be anything like in white. I still remember in white-eyed blowout fracture, there was a child whose clinical picture was present. Then there was a CT scan picture which was there, and then they were asked multiple questions. So there's going to be one bigger stem and one or two pictures, and there are going to be 3 or 4 subsequent questions related to that stem. So it's going to be a very tough, tiring exam. Those 90 minutes were not enough to complete this OSCE booklet. So just be very, very fast, be very accurate. There was a question I still remember about facial nerve palsy, and they asked everything related to facial nerve palsy. There was a picture of a female with the paralysis face of one side. That's it. And then they asked all the question related to facial paralysis. There was a question related to sling. So just to make you understand that they are going to ask you every single thing, you have to be very, very fast. I think I might not been able to answer all of the questions, but I might left like 1 or 2 stem. I mean, I did attempt all 15 questions, but one or like in every question, I might left 1 or 2 stems that I thought I'll be able to complete later on, but that later on never came. So just try to be fast, and if you don't know any answer, don't waste your time on thinking. Just go to the next question. So the other paper was from my friend who passed his FFD in November 2023, and he sent me all these questions. These were just the first stems, and then there were subsequent questions related to everything. So you might get a picture, you might just get a stamp or anything, but you should know the topic in detail, and you should be able to answer all the subsequent questions related to that particular topic. So this is the paper B component, and you're done with writing once you're done with your OSCE. Now the next 2 components are just going to be the oral exams. So the third component is the simulated clinical examination. You are lucky in a way that you don't have to apply for paper A clinical scenarios. However, I did apply for paper A clinical scenarios. There were 2 scenarios from paper A and 2 from paper B. You're lucky enough in a way that now they have restructured the exam, and you just have 2 clinical scenarios, which might be from paper A or B. So there is going to be probably an amalgamation of paper A and paper B in this particular component now. So I am going to give you a little detail about how you're going to have your clinical scenarios. So this is like a stem. I hope you all can see the stem, right? Sorry. So this is like the stem, and you are going to, once you have attempted your OSCE stations, then they are going to divide you into different groups, and they are going to intimate you that you are in this group, and then you are taken, the next part of the exam is through those groups, because some of you might have exam in the morning, some in the afternoon, some in the late hours. So it depends how many candidates are there, and how they are going to divide you. So you might be there. There are usually probably around 8 to 10 or even more examiners, and they are from Ireland, UK, or even from Middle East. Who usually are dual qualified, so they know a lot about medical component as well. So you have to be very, very crisp in when you are answering them. So, at your time, they're going to take you in, and everyone is going to follow the same scenarios. So, there's no biasness element in this exam. You all are going to follow the same pattern, the same cases. So, whoever makes it through the exam is the one who did better or probably the best that day. So, basically, they let you sit and read the scenario for 1 minute. It is usually scenario or a referral letter. Like you can see in the picture, there is a little referral letter. They usually might mention the age of the patient and a little something about the patient, that they have a complaint in the lower left quadrant following tooth removal 1 month ago by one of my locum colleague, something like that. Okay, and then they refer the patient to you. So when I gave this exam in 2021, it was during the COVID time. They're usually simulated students who are there, or a simulated patient. You just have to take history from that particular patient, and you don't have to do any clinical examination on the patient. So in my exam, one of the examiner, there are two examiners who are going to examine you on this one clinical scenario. So one of the examiner became a patient for 5 minutes, and I have to ask questions. And then he again went back to his seat and became the examiner. So you were provided a paper and a pen, and you can write down whatever you think is important. So the things which are important is that they ask you, that you have to introduce yourself first, because try to be as normal and as human as you are, because don't take too much of the stress of this exam, because they can sense that. And I would always suggest that you have to be very clear in what you are asking. It's okay if your English is not nice, but at least they should be able to understand your language. So I think you should introduce yourself, take permission from the patient that you're going to ask certain questions. They might be personal to the patient. Is he or she willing to answer those questions? And then start your history. So in history component, you are going to ask about the medical history, the past surgical history, and the um, social history of the patient, usually, because you just get 5 minutes for this component, and you have to make sure that you take your history in such a way that you're able to provide with some differential diagnosis to the examiner after taking the history. I am going to go through with some of the clinical scenarios with you, but just to make you understand that you just get 5 to 6 minutes for this component. You get 1 minute to read the scenario, and then another 5 minutes for the history taking. And then the examiner is going to examine you or ask you questions, one examiner for 10 minutes and another for 10 minutes. So I will tell you what my examiner asked me. So the first examiner usually asks you, because they do listen everything what you are asking from the patient, and they do write it down. So make sure you don't ask anything which is irrelevant. Don't ask anything which is not required, and still you're trying to ask, because they are going to ask you questions later on that. So one of my clinical scenario from paper A was about Bell's palsy and bronchial carcinoma. So in 2023, they asked about gallbladder stone or obstructive jaundice. I can give you a little clinical scenario how it was presented. So it was written in one of the paper that a 35-year-old male fit and well has weight loss and bleeding with stools. From history to find out, you have to keep the certain things in mind, because this was all that was written, and he was referred to us. It was about paper A. So you might be asked about paper A or paper B in this clinical scenario situation. So that was a scenario of a Gardner syndrome or ulcerative colitis, and you have to exclude Crohn's and bowel CA. So it could be anything. There was another question. Um, a 35-year-old barber has chronic cough, which I have mentioned in 2023 exam, fever and blood in the sputum, and he also works at a hospital. So they were asked about TB investigations, prevention, treatment, and especially what tests are required for children. So, you can be asked anything. You have to take your history in such a way. So you have to take your history in such a way that you reach to some diagnosis, because the first examiner is going to ask you, summarize your case for me, and then he or she might ask you the differential diagnosis. So you might, after those 5 minutes, you have something in your mind to tell them about the differential diagnosis, and then they take you from there. The next examiner usually takes you to the final diagnosis, or the definitive diagnosis of that particular case, and he might answer you all the investigations, everything. I still remember there was a question about a 40, the November 2023 question number 1 was actually a 40-year-old lady with the right side abdominal colic pain and jaundice. The candidate might be asked about obstructive jaundice, ERCP, MRCP, bile formation, obstructive jaundice complications, features, anything. So you have to read your medical component in detail. I just want to make you understand that it's not that simple. Passing the theory is not important, but passing this is very, very important as well. Because even if you passed your paper A, passing this clinical scenario alone is a major component of this exam, and this has a 60% weightage. So even if you pass your theory component and you couldn't make it to clinical scenarios, you're not going to pass your paper B, and you will not get the fellowship degree. So so I have a list of all the scenarios from the past few friends, and we can share with them, with whoever wants to give this exam later on. So just to give you a little taste of how this exam is. So in November 2021, from paper A, I was asked about something about Bell's palsy and bronchial CA. And in paper B, which you might think is like paper A, because they did ask me transient ischemic accident and warfarin use in one of the questions, and the other one was related to Gardner syndrome, in which they did ask about the carcinoma and everything, which can happen in Gardner syndrome. So you have to understand that it's amalgamation of everything. So the last component is your viva component. In you're going to have two clinical scenarios. I had 4 clinical scenarios, 2 on my first day and 2 on my next day. Like 2 were from the general surgery, 2 from the oral surgery and oral medicine. However, you guys are lucky, you're just going to have 2 clinical scenarios now. So, but I am not sure how they are going to be. They could be, because it has been mentioned in the website that they could be from the general surgery, general medicine, or oral surgery and oral medicine component, or an amalgamation of both. So just be careful. You try not to forget your general surgery and general medicine component there. So the last component of this exam is a viva, which is also quite a long component, and you have 4 examiners, and so on one table there are like 2 examiners. So during this exam, I think there was not even a single examiner I couldn't meet, because you have to meet a new examiner in your clinical scenarios, 2 different examiners, and then in your other clinical scenario, you're going to meet with 2 other examiners. So you are meeting with 4 examiners in clinical scenarios. Similarly, in your table viva, you're going to meet with 4 examiners. So they try to make so that the RCSI try to make sure that you somehow go through all the examiners and not just a pair of examiners. So there are some examiners who are quite strict. There are some who were quite friendly, but trust me, none of them were any bias, or they all want to make you pass the exam. So the Irish language is little fast. You try to understand as much as you can, but if you don't understand anything, try to be gentle and ask them again, so they can make you understand what the question is all about. But the whole exam is in English, so If you have little apprehension or if you are too overwhelmed about this exam, so I think you should think before attempting this exam. So the table viva component is on the last day, and it's 15 minutes for each examiner. So for one pair, you have 30 minutes. So when you appear on your first table, there are two examiners there, and a bell rings. That means you are going to start with your first examiner. They have their laptop or iPad, whatever, and they are going to show you their clinical scenarios, and they are going to ask you questions related to those scenarios. It's more or less like our FCPS table viva. So I gave my exam in 2019, and it was exactly like my table viva there, which was a rapid fire round, and but there were no laptops. So in Ireland, they give you, I mean, they are going to show you their cases or anything, and they are going to ask you questions related to that. So I put one of my table viva question of November 2021, in which the examiner showed me I think it's been a while, so I might not be able to recall everything, but it was something. I think the first one was the clinical picture of a patient who has a swelling on one side of the face. And he asked me, okay, explain what you see in this picture. And then the next one was a CT scan where you can see an infection or an infratemporal space infection. So you have to understand that you are going to be shown CT scans, MRI, or PET scans, and you must be able to read those scans, because if you won't be able to read those scans, you won't be identify where the problem is, and then they are going, you are going to be in much mess. So try to make sure when you apply for this exam, and when you are sitting for the exam, you're well aware of every component of the exam. So it was an infection of the infratemporal space, and then he asked me about the DDs, the management, the approaches to infratemporal space, the landmarks while doing the surgery, the vital structures that I might encounter, post-op complications, and how to reassure the patient, what post-op instructions I have to give to the patient. So everything. So you might be asked just from one patient, or they might ask you multiple questions. So you have 15 minutes with one examiner, and then a bell rings, and then the other examiner, which is on the same table, you shift to the other examiner. He or she might start with the exam, and they are going to go through the same way. So I can tell you, one of my examiner asked me about surgical emphysema. I was fortunate enough that I have not seen surgical emphysema in my life before. But, when we are studying, our teachers always tell us not to use this handpiece while you are doing any surgical procedure, that particular handpiece. So, when she showed me a picture, I know that the surgeon was doing a surgical extraction, but in the other picture, I can see that the patient had a swelling in the third CT scan picture. So I was not able to diagnose anything so far. So by the third picture she had shown me, it was of a CT scan, and there was a big air embolism, which I can see. So by that time, I did pick up that there is an embolism. But then I asked her to go back to the first slide, and I was trying to figure out what was wrong here. And then I picked up that this was the handpiece which we were asked not to use, and that was the reason of that surgical emphysema. I was lucky and fortunate enough that that did click in my mind at that time. But just to make you understand that we might have not seen those cases before, so you have to be very, very vigilant, and you have to be there. I mean, you have to be present in the moment to answer those questions. So I can tell you my other questions. One of the examiner asked me about a high angle case in which he showed me a patient who obviously had a high angle. It was related to orthognathic surgery, and then he asked me how you're going to explain this patient, what is the skeletal class, what are the problem list. He had a model with him, and then he asked me God knows what from orthognathic surgery. So that's a major component. You have to have a very good grasp of orthognathic component. So try to cover that, because they have like 15 minutes. They can ask you all the questions from that one patient. So he made sure he asked me everything related to orthognathic surgery. Then one of the examiners showed me OSCC case. It was an OSF, which turned out to be OSCC. OSF is something which was quite rare, but the other examiner, I mean, he is an Indian, and he asked me a lot about OSF. So I was told that they are not going to ask about OSF, but see, they did ask me about OSF. So that can happen as well. So one of the examiners showed me a multicystic lesion from right side of condyle, and he asked me everything, you name it, and he asked me related to cyst, tumor, benign, malignant, whatever. And then, there was a friend who told me that he was given a case of ossifying fibroma, and they asked everything from ossifying fibroma. So you have to be very, very careful what you answer, because your one wrong answer might lead to another wrong question, which might lead to another wrong answer. So try to be present in the moment. You might be asked about CT scans, OPGs, X-rays. They might give you investigations. If you're not clear about something, you might ask them that, I should ask. I want to ask about you this thing. That is there a biopsy which was done, and what was the result? So please try to ask if you are confused about something, and just be very, very polite to the examiner. Don't try to mess with them. I mean. You may find some a little aggressive, or you think that they are a little being harsh, but that's not the case. This is how this exam is. They are taking this exam for a couple of days, and they are equally tired as we all are. So try to be polite, try to be as reasonable as you are, and it's just an exam. So, calm down yourself. And once you're done with this, then you have made it to FFD OSOM exam, and now you have to wait for the scores. So the passing ratio for this exam is quite low, unfortunately. So usually 15 or plus candidates apply for paper A, and you have to pass each component with more than 60% marks in order to pass this exam. So they usually pass, it depends, I mean, how many people make it to paper A. So usually 1 to 4% people pass this exam, paper A component. And then in paper B, they have lot more component people, because candidates, because there might be people who have passed paper A and they want to reappear in paper B, or there might be people who have passed paper A long time back, and now they want to resit for paper B. So it's going to be lot many people in paper B than paper A, or there may be someone who was exempted for paper A and they are sitting in paper B. So you have to pass each and every component of paper B as well. You have to pass the theory component, the OSCE component, the clinical scenarios component, and then the viva component. Every single component has to be more than 60% in order to pass paper B. Similarly, the theory component and the critical reasoning scenario questions for paper A, which were the 14 questions, you have to pass each one of them with more than 60% marks to pass paper A. Dr. Fahad has kindly, gratefully, he has explained that you have a certain time limit to pass paper A and paper B, and there are certain attempts in which you can only appear for paper A and paper B. So once you have passed both the papers, you are quite lucky, you have made it to exam, and this is what you will get in your email once you pass this exam. So they do mention that it will take weeks time, but it usually doesn't, because before I landed back to Pakistan the other day, the result was out. And that's it. This is the website where you can contact them, and you can ask them any questions there if you have any, or you can put down in chat, and we're happy to answer. Thank you.
Thank you so much, Dr. Maida. It was a very elaborate and exquisite presentation. I think we probably won't have any question and answers, but still I'll take it from the top, and if anybody has any question and answers, so please start leaving these in the chat box. I'll take it from the top and see if we have any, so we can answer them. We had a question by Dr. Numra Shakil. Is it necessary to give both parts of MFDS? Yes, you have to get exemption from part 1 and then you have to pass part 2. Then you can sit for the FFD. But I think Dr. Faisal has already replied for it. Yes, in fact, आपने भी किया हुआ है, Dr. Maida. You replied here as well. Okay, we have a question by Dr. Aisha. Does MFDS award fellowship certificate? No, MFDS is a membership. It's not a fellowship. As far as this DHCA licensing exam is concerned, I'm sorry, I don't have any information about that. This is not a webinar on licensing exam regulations. You will probably have to go through their website and or ask somebody who has cleared this specific exam. that what exemptions do they give you based on FFD or MOMS or FCPS or any other fellowship certificates. Is this fellowship or just membership? Like I said, MFDS is just a membership. It's not a fellowship. Fellowship is your FFD exam. So, okay, we have a question here which isn't answered by Dr. Neelam, that are there any preparatory courses available for FFD for both parts of the exam? So, Dr. Maida, if you can take this
So,
one.
one of my friend, Dr. Karthik, he has already passed FFD exam and we are lucky he's here. And he has already shared the link in the chat. There is a group which you can join, and there are candidates who wants to appear in this exam and they can join that group. Unfortunately, I don't know any preparatory course, but me, Dr. Fahad, and people like Dr. Karthik and everyone, we are happy to help whoever wants to sit for this exam. I've already shared my paper and I can share all the past papers with you, whoever wants to sit for this exam.
All right, wonderful. Okay, we have a question by Dr. Ufak Rao that once we get the eligibility for FFD RCSI and not attempt the exam, do we need to get the eligibility again? No, once you get the eligibility letter, so you then there is no need to refresh it, so as to speak. So once you have it, you can use it whenever you want. So no need for that. Okay, there's a question that regarding my future directions, which I shared, that if the FFD is going to be dissolving in 2026, then should you give the MFDS Part 2 in 2025? Well, it depends on you. I think if you are able to pass MFD Part 2, let's suppose in maybe January or February, if there is a diet of the exam in those months, then I think you should be eligible for the maybe the April attempt of the exam. So I think April or November would be a good shot for you to give the exam if you have cleared your MFDS or MFD by then. So, and again, like I said, this is only one letter right now. They haven't specifically said that we are dissolving the FFD in 2026. It is very much possible they might let the exam stay on. But like I said, further communication from all these four royal colleges will is what will give us more explanation in this regard. I only told you what I made of that letter that they shared with us. So, but oral surgery, oral medicine was one of the specialties that combined letter addressed. That these specialties will get involved and have a one single unified exam across all the four royal colleges. So is part A same for oral surgery, oral medicine, and oral medicine? I think oral, if you go into the FFD regulations document, you can have get that from the RCSI website. So there's a single document for all specialties, and you can see the layout, the syllabus, and the paper layout for both these exams. However, what I've heard from other people, again, this is hearsay, so please take it with a pinch of salt, that the FFD oral medicine exam is harder to pass, I've heard, as compared to the oral surgery and oral medicine exam. Because the problem is that since, especially in Pakistan, we don't have a fellowship or a MDS program in oral medicine. What you have is basically maxillofacial surgeons who are practicing and working in oral medicine. So we are not trained really in oral medicine. It's more of what we are following in the books, and we don't maybe have dedicated supervisors who are teaching us oral medicine. So maybe it is harder in that context and regard, but you'll have to go through the regulations. I can't say much about this. Dr. Maida, if you
So
want to
the
add anything
exam,
about it.
yeah, the oral medicine exam, the theory component is same. They were just given a different theory paper, and the clinical scenarios were the same because there were people who were attempting the oral medicine component there, and they had the same clinical scenarios. But unfortunately, I don't know anyone who has passed the oral medicine, individual oral medicine paper so far. So most of the people I know, they apply for OSOM exam. But you can
Yeah,
apply for
plus
OM.
PMDC does recognize the oral surgery, oral medicine program as an oral medicine degree as well. We had a couple of our seniors who, based on their FFD in oral surgery and oral medicine, got jobs as assistant professors in oral medicine. So that is one. If you're not sure about oral medicine, you don't have people who can guide you about FFD oral medicine, then you can just do oral surgery with oral medicine. Maybe that would suffice as well. Right, we have a question for you, Dr. Maidaf, by Dr. Abdullah, that what about Kumar and Clark versus Davidson, your preference?
So
I'm a Davidson guy. I studied that when I was in third year,
I
but
did I
everybody
did
has their own
study
preferences.
Davidson. I will be honest, I did study Davidson, but it's very hard to cram all of the Davidson. So in the end, you're going to study this book, no matter
All
what.
right, wonderful.
This is the one you're going to remember there.
Wonderful, wonderful. All right, we have another question. Any age criteria for part one? Are you asking for MFD or for FFD? Kindly elaborate on this so we can get back on this. But there is never an age criteria in any FFD or MFD regulation, so not a problem
Unless
for
you're
that.
older than the examiner who's taking your
Yes,
exam.
that could be one of them. Yes. Any guidelines for the MFD exam? I've already shared them, Dr. Anam, in my part of the webinar, but I'll be, inshallah, sharing the recording. So if you missed that portion, so you can catch that from there. And yes, Dr. Karthik has shared a WhatsApp group. So if any of you are interested in giving the exam, you can check it from there. And oh God, my Zoom is hanging up again. Let me see if Dr. Maida, if you could just read other questions in the chat
Let
because my
me,
mouse has hung up for some reason.
yeah,
So
let me
we can answer that.
just hang on. So someone said there is a baby Davidson also available. It's up to you, whichever book you like. I mean, I have told you the books I've studied, but if you are like Dr. Fahad and can read Davidson, great, do it. So
I
what
think
about
it's
you?
ultimately a choice of preferences and
Yeah,
whatever you're
exactly.
comfortable with.
Whatever you can
Yes.
recall there.
Yes. So there's no like hard and fast rules that no, you only study these books only, then you'll pass. And if you read something XYZ, then you're not going to pass.
Yeah.
So I don't think it's
And
anything like
having
that.
said that, just remember this thing that, oral surgery, oral medicine is one of the component, but sorry, general surgery, general medicine is one of the component, but oral surgery, oral medicine is even way harder than general surgery, general medicine. So the people like me, Dr. Nigam, and some others were lucky enough when we applied for this FFD because we were either just done with our FCPS or about to get done. And somehow we don't have to study with this component. But if you are doing MDS or you haven't done your FCPS, you have to go through a lot for oral surgery and oral medicine. What about the worth of FFD after 2026 as they are going to change the fellowship exam? So I think they are going to have some other guidelines for the people who have passed this exam before. Either they'll be exempted or, they have to give a minor exam. I don't know about that, sure. Very sure about yet. But there's going to be something for the people who have already given this exam and passed this exam in before. But as far as 2026, I'm not very sure. Um, Do UAE accept the MFDS exam? MFDS is a membership exam and it's not a fellowship exam. So um, I don't see you might have any advantage with MFDS in UAE. You still can only practice as a general dentist and not as a specialist. However, with FFD, you can apply for specialist in UAE as far as I know. If you have I think 3 years or more of experience. Um, Can you please tell how much expenses for paper B to go to and give it in Dublin or Bahrain? I mean accommodation. Okay, so this is important because I've been to Dublin and I can share my story that you should apply for your visa as soon as you get your acceptance letter from RCSI. Someone's mic has to be put on silent mode. So once you get your approval from Dublin, from RCSI, you should apply for your visa in Pakistan. If you are in Pakistan, then I can tell you it's through Jerry's, and there you have to apply on the official website. There is a prerequisite form. You have to fill the form, and then you have to send the form. Then the Jerry's give you certain dates for appointment, and you have to go to the Jerry's, and you have to fulfill all that criteria. You have to do your biometrics, submit all the passports there, and They usually give you the visa after a month or so. So I was lucky enough, I received my passport in the morning, and in the afternoon I had a flight to Dublin. So you have to make sure that you submit your visa processing as soon as you get your acceptance letter from RCSI. You will get your acceptance letter once you pay the fee. So once you have passed your paper A, which you are obviously going to sit at home and give your exam, so once you get the letter that you passed your paper A and now you can apply for paper B, then you will apply for your paper B. So let me clear you one thing. Once you have passed your MFDS 2, you have to apply for FFD because there is a diet, there is a website. You have to open the website. You have to apply for FFD. They have a diet in which they reconsider all the applications, and then they send you a letter that you are eligible for this exam. Because first you have to ask them that either you're eligible even after passing MFDS 2. Then they send you, because you have to submit certain documentation to them. You have to submit your residency documentation. You have to submit a letter from your supervisor, probably a recommendation letter or something like that. I don't remember, it's been a long time, but you have to you have to submit certain documents, and then they let you and then they mail you that you're eligible for this exam, and then you have to make a login on the website. You have to apply for the exam. You have to pay the fees, which you might have already done for your after like you have done it for your MFTS. So but even after passing MFTS, you have to apply for FFT. You have to ask them if you're eligible. Once you get the eligibility, then you have to pay the fee. Once you pay the fee, then you are going to sit for paper A, which is online. And once you have passed the paper A, then you have to again apply for paper B. Once you have got the acceptance for paper B, you have to pay the fee. Then you will get a letter that this exam is going to happen in Ireland, and then you have to take that letter along with quite some other letters, and you have to apply in juries for your visa. um, just to make you understand that it's quite a time-consuming work. So apply as soon as you get your acceptance letter for paper B, because the visa might take little longer. I know people who didn't get the visa for the exam. In that case, RCSI might return your fee, because I know somebody who couldn't get the visa, and they gave two options: either sit for the next exam, or they can reimburse the fee. So my suggestion only is to apply as soon as possible. And once you apply, you have to show your reservation. So try to book a place which is near to Dublin. Dublin is quite expensive, so this is going to cost you a lot. The exam is going to be 3 days, as far as I know from their website. So you have to go either 1 or 2 days prior, and then obviously you're going to come back even a day later. So accommodation for 4 to 5 days cost you a lot. And since RCSI is in the center of Dublin, so that area is quite expensive. So make sure it's going to cost you a lot. Dr. Fahad is back.
Yes, I'm back. I've lost the questions of the chat, so if you can just go through them and I'll
I'm
chip in
going.
wherever I can.
Okay, so somebody asked about paper B and the cost and everything. So list of somebody asked, Vishal, kindly share list of topics of general surgery and general medicine. I mean, the list is never ending. It's like you're asking for the sun. I mean, how can I answer this question? But I can share you all the past papers, and I did mention you have to study for journal medicine more than the journal surgery. Well, I have made a list on my book of Kumar and Clark of the systems and the topics that I did study, and I can share with you. But that's my list. I mean, that won't make you pass the exam. So I don't know. RCSI has to make this list. Uh, Any guidelines for MFT? Unfortunately, I'm somebody who got the exemption from MFT. So I don't know. Dr. Fahad can tell you better on MFT, but I have friends who have passed MFT recently. It's quite a simple exam. It's more of the general dentistry, more of the OSCE questions, and I don't know anyone who couldn't make it to this exam, honestly, who has studied for a month or so, and everyone I know did made it to MFTS Part 2. So it's quite a simple exam.
I think it's again a difficult question for me to answer as well because I haven't given the exam. Though the one thing when I was studying for it, I did ask a couple of people who had cleared it. So the best advice that they gave me, which really stuck in my mind, was that the problem with people who can't pass MFD Part 2 is that since we've gone through specialization training, we now think like surgeons. And in at MFD level, basically you have to answer the examiner like a general dentist. So you have to show that you are being a safe person and a safe doctor, a safe dentist, a safe practitioner. But you have to keep in mind that you are now answering as not as a specialist. So if you have a surgical scenario as an OSCE, so I think you're not supposed to answer that, oh, I will do everything by myself and I don't need to involve everybody. I don't need to refer the patient to anybody or anything like that. So you have to answer basically like a general dentist. So you have to show responsibility and safety. So that is the biggest thing that I took away from it. Plus the group that I shared, they do share previous stations over there. And I think they also share answers over there. And there are some people who have even released books on it, on model answers for this. So you'll probably get that from the MFD examination group on Facebook that I shared. So probably that. The biggest thing on the preparation that I can tell you is most people go for the Oxford Handbook of Clinical Dentistry. I think it's 7th edition, which came out. So you definitely have to read that. And other material you will find across from the book, but from the group. But this book, sorry, Oxford Handbook of Clinical Dentistry, this is a must that you have to read to prepare for the exam.
So there is a
I think Dr.
question.
Anzish has asked a question for you, Dr. Maida.
Yeah. So there's a question related to radiology for part. So Dr. Fahad, I did it in one of his session on CT scan. So he's the right guy. You should learn CT and MRI from Dr. Fahad because trust me, with that you can pass FFD because they show you CT scans and MRIs and like in FCPS, like they are going to show you slides and then you have to identify the problem and then they are going to ask you questions on that. So the CT scan component was, as far as I know, it was asked in the viva, table viva, not before that. So, I mean, and then you have to be very good in that in order to pass this
I
because the
think
examiners
it's
are going to mark
similar,
you.
like you have to, the way you prepare for your FCPS part two, you have, in terms of radiology, you have to be prepared the same way for FFD as well. I think Dr. Anzish was as asking a question that did you get exemption for both parts of MFD? I think at your
So
time,
yes,
there was no
I did.
requirement for
Yeah.
MFD, I
So
think,
I applied in 2019 as
before
Dr.
the rules changed.
before the rules changed. So I
Right.
was the last batch who
Mhm.
were allowed to give it before MFTS.
Right, right. All right. So this is one question that I got. If there are any questions that were left when in my Zoom crashed, so if you could kindly go through those, Dr.
Mm,
Maida, or are we done with the
yeah,
questions?
I am trying to see if anything is left. 3 lakh fee for each part. Oh my God, somebody already mentioned that. So I think it's more, it's just the fee. By the way, you were mentioning the cost for the accommodation was way more than this because I stayed just next to FR RCSI and it's quite expensive there. So try
That's why I
to get,
said that that 4 attempts thing does not apply to
yeah,
us Pakistanis. We'll have to
yeah,
do it in maybe one, maximum two
yeah.
attempts. Yes. So, all right, we have a question, I think, from Dr. Mazhar that can you appear for FFD after MOMS without appearing in MFD Part 2? I actually tried this thing with the RCSI that can you give me exemption from MFD Part 2 because I'm already a member of the Faculty of Dentistry at Royal College of Surgeons of Edinburgh, and they did not accept that because MOMS is not a recognized specialty at their level. So moms will not give you any exemption in this regard. You will have to sit for MFD Part 2 in order to sit for FFD. Moms does not give you any exemptions in this regard.
So there is a
Uh,
question from Dr. Zahoor. Are FCPS qualified exempted from MFTS 2 to appear in FFT Part A? No.
No exemption. Just you get no exemptions from part two, basically. Just put this in your head. There are no exemptions from part two.
So Dr.
Uh,
Andish asked, is FFD RCSI same as FFD OSOM? So FFD is the same exam. It could be of ortho. They mentioned ortho. OSOM means oral surgery, oral medicine. So FFD is the main exam, and RCSI is the Royal College of Surgeons of Ireland. So we try to not write OSOM because it's quite understandable. If a surgery person has given it, it's either OSOM or just OM or just OS. You can either give oral surgery, oral medicine, or someone like us who bother to give both of these. So you can give oral surgery, oral medicine together. So it could be either three of these. If you want to apply for oral surgery, then you can only have to apply for oral surgery. If you're applying for oral medicine, you can only sit for oral medicine. But for
I
OSOM,
think, Dr. Maida, let me correct you here. I think oral surgery is not open for us. It's only open for UK
there was
trained
a
people.
time it was open, what I
Have
remember,
they
but
changed it
now,
now?
yeah, they have changed it.
Oh, all right. Wonderful. Wonderful.
Or they might change it because I know someone who told me that, they might change it for
All right.
sooner.
Okay, we have a suggestion that we should start a preparatory course for FFD. Well, I think that's for you, Dr. Maida.
I
uh,
think you have
I
a
think
more
when I
knowledge
passed
than
when I passed MOMS, I was told by a few people to start a preparatory course for MOMS, and I told them that you don't need a preparatory course to pass MOMS. If you've studied well for your FCPS, so you just need to tweak it minorly, and you can pass for the MOMS. But the major reason why I didn't opt for FFD was this general medicine component. This used to scare me a lot, and still does scare me. So probably a preparatory course for FFD is maybe the need of the hour for people who are considering it.
So, as far as I know, there is no preparatory course which is currently available, and everyone who has done this exam is our seniors, our friends, our colleagues who have helped us, and then obviously our own self who bothered to even go to Ireland and gone through all the hassle for this exam. So there's one thing I would like to mention here, that this exam, as it sounds, it's not that scary. The exam is not biased at all. Everyone is going to have the same questions, the same scenarios, the same things. So if I pass this exam and you couldn't, there might be a reason that I was better in something, and you can understand those things later on, and you can pass this exam. So although the passing ratio is very, very less, but the exam is not as scary as it sounds. It's quite a straightforward exam. You just need to have a very good understanding of all the components, and you have to pass all the components altogether. That's it.
I think Dr. Anzish is referring to some email that Dr. Adrian shared. So I'm sorry that I've lost the chat. So if
Adrian, can
you
you
know
share
what
again? I mean,
email Dr. Adrian is
uh,
referring to, so maybe you can
Adrian,
answer
is he
that
here?
better.
I don't know. We can ask him. I mean, Dr. Adrian has not given FFD, but he really wants to give FFD, and he's from Hong Kong, so he might have shared something, and I don't know. Let me see what he shared.
If there are any more questions, please let us know while we try to find this email. Or Dr. Adrian, if you could kindly share the
Okay.
email that Dr. Anzish here is referring about. I'm sorry, I can't find it in the chat.
So there is an email which was sent at
Oh,
4:05. I mean, I have to open it. Uh, So he's referring some, I don't know, there was some sort of a query from Adrian to them, and they did mention that the exam of FFD RCSI is still the same, and they're going to hold a new pattern for OSOM exam. That's what's mentioned in the email. I think, reshare it.
अस्सलाम वालेकुम मामू।
I
बिल्कुल
think they're
ठीक
just
ठाक
talking
मामू, आप
about
ठीक है?
this pattern that now they've split the exam into part A, which is online, and part B, which you have to give face to face.
बिल्कुल ठीक
So
ठाक।
I
घर में
think
भी सब
the
खैरियत है, मम्मानी ठीक है?
participants, please keep yourselves muted, please.
हम्म,
I think maybe
जी मैं
Dr.
वीडियो
Adrian
करती हूँ
asked
जी।
them about the email, the notification, that combined letter that I showed to all of you. I think they were probably talking, maybe he referred that email that are you changing the FFD into FDS or not?
So
Probably
I
all of
have
that.
shared
जी
the
मामू बिल्कुल ठीक चल रही है अल्हम्दुलिल्लाह।
I have shared the email again. You all can read now.
All right. Any other questions? If I've missed out anything or Dr. Maya, was there anything left in the chat before
No, I think we have
or we've
covered
covered
every
everything?
single thing.
All right. So I think
I think so. We've covered everything.
we've covered everything. I think our webinar was elaborative enough, inshallah. So thank you very much, Dr. Maida, for giving us so much of your time and taking again so much time out, putting the effort in to put this into a document and letting me record this and everything. So I think it'll be a source of great sadqa jariyah for you, especially because I know it's not easy guiding everybody about such an exam and sharing your experiences and everything. And we're also very thankful to our participants who joined us, especially on a Sunday. But I'm sorry, this is the only free day that we had. So thank you for ruining your weekends for us. But I'm sure, inshallah, in the long run, it will be very helpful for you. And hopefully, we do earn a little bit of sawab for the help that we gave you when you pass your exams, inshallah. So, inshallah, I'll try my level best to. I hope that my continuous Zoom crashing has not affected the recording. So I'll share that hopefully by tonight on my YouTube channel and share it in the WhatsApp groups that we had. And you can obviously then share it with whoever needs it. So thank you, everyone. Thank you, Dr. Maida, once again. And let's hope for more, more collaborations in the future on things that
Thank you so much,
our
Dr.
juniors
Fahad.
and our colleagues would need.
Thank you so much, Dr. Fahad, and everyone. And it would have never been possible without you, Dr. Fahad, because if you wouldn't push me for this, I would have never done it. So thank you so much. And you have always done great work. As far as I know, since my FCPS days, I always, you have been a source of inspiration for all of us, truly. I mean, I did my FFD, FCPS because of you. So you are the reason for so many degrees we all, proudly show to the world, but you are the reason behind those degrees for sure.
Thank you
Thank
so
you
much. You're
so
being far
much.
too kind and too modest for your own good, I
No,
will
no,
say.
no.
Thank you
No, no,
so
no.
much.
I'll be honest here. You are actually a role model for all of us. And I hope we can chip in a little bit because you are a source who is providing so much to every junior, everyone around us. So thank you and keep doing it because no one knows how you're helping others. And you truly are someone who is, who is always there. Even if we need a book, an article, anything, you're there to help. So thank you and keep
Most
doing
welcome.
that.
Most welcome. Most welcome. Thank you so much. Then I see you next time, inshallah, wherever fate would take us. And till then, take care of yourselves and best of luck for all your future endeavors. Thank you so much.
Thank you. Bye.